Happy Hump Day, everyone. It's Wednesday, July 20th, 2022. I'm Dr. Dan Lieberman, your medical director at Phoenix Spine and Joint, and I'm here to give you today's update on all the news that's fit to print, on all the information that's out there. Today, I actually want to talk about a little bit of misinformation, and we're getting a little far afield for me. Today, we're actually going to talk about depression. Um, my own expertise when I was practicing was in neurosurgery, did a lot of neurology. Psychiatry is part of neurology. So I've always had a interest in neurotransmitters, but even more than that, just an interest in science and how information relates to science. And this is certainly one of those situations where kind of some crazy media stuff going on, which I think could be potentially harmful. And I do just want to point it out. And long story short, don't stop taking your antidepressant medications because of all the flurry of reports today that serotonin failure does not cause depression. We'll explain how we got there one step at a time, but kind of let's start out with what's happened. Today, July 20th, we see in Psychology Today evidence that serotonin failure does not cause depression. A recent study offers insight into why current depressive therapies fail. It's funny how the media, when new things come out, when information presents itself, everybody just kind of processes their own narrative. A recent study provides conclusive evidence that low serotonin levels do not cause depression. Well, I mean, where this comes from is a lot of doctors, when for many years we had, virtually no treatments for depression other than therapy. And when the first medications came out, they were SSRIs, selective serotonin reuptake inhibitors. So they were chemicals that made more serotonin available to the brain. And a very simplistic view of depression then would be, well, if more serotonin relieves depression, then less serotonin must cause depression, right? Of course not. I mean, that's like saying the lack of fire retardant causes fires. So there's no reason to put a fire extinguisher on a fire because the lack of it was caused by a match, not the lack of fire retardant. So how could it possibly put it out? It doesn't matter whether, I mean, that was a huge leap to say that the lack of serotonin was the source of depression and that more of it would be the treatment. It just means all the studies that were done just proved that maybe more serotonin relieves depression. That doesn't actually mean less serotonin causes it. But let's look at, so this article in Psychology Today, which is usually a really good source in my opinion, goes through how these SSRIs depend on their ability to block reuptake. Are they even effective? That's a question that seems to come up all the time, and we're going to look at that through our own prism of we want to rely on a meta-analysis of clinical studies, and we'll take a look at that. Science concluded that depletion of serotonin could produce the symptoms of depression, then it should be possible to treat it by enhancing function. Again, that's a red herring. If serotonin reuptake reduces depression, who cares what causes it? We just want to get rid of it. So a lot of weird stuff in that article. There's, this one came out today, July 20th as well. No evidence that depression is caused by low serotonin levels. Okay, who cares? Finds comprehensive review, great. After decades of study, there remains no clear evidence that serotonin levels or serotonin activity are responsible for depression. Again, great. Who cares? If serotonin reuptake is effective in reducing depression, who really cares what causes it? I guess researchers care, and they should, but as family members, as individuals with depression, stuck in sadness, difficulty with appetite being reduced, you're locked in this horrible negative cycle. If you could take a pill to get rid of it, wouldn't that make sense? Of course it would if the pill actually worked. again, this article is about this new study which looks at the etiology of depression and doesn't actually say a word about SSRIs, the medications. And of course, the SSRIs are Zoloft and Paxil, I think were the first ones, two of the most common antidepressants in the world. Prozac and even Effexor, these are drugs that really have saved and changed a lot of people's lives. Full disclosure, one of my own siblings, her life was just flat out saved by Zoloft, and I'm forever grateful to that drug for saving my sister's life. So bias, full disclosure of a bias. I've had a personal experience which makes me think these drugs work, and acknowledging it, I have that bias. I'm going to have to make sure that doesn't taint my evaluation of the information as it comes in. And here's another publication today. Little evidence that chemical imbalance causes depression. And they all quote this same study. And then this lady, Joanna Moncrief, professor of psychiatry in London. Many people take antidepressants because they have been led to believe their depression has a biochemical cause, but this research suggests this belief is not founded in evidence. No, people people don't take antidepressants because they believe their depression has a biochemical cause. People take antidepressants because they're depressed and they want to get out of it, right? Doctor, I don't know who this is, but she sounds like she's sort of a maybe someone with an agenda and not necessarily. I mean, that's just patently stupid. People with take antidepressants because they've been led to believe, like people are sheep and they've been led by these evil doctors to believe in this false notion. No, people are depressed and it's horrible and they're trying to get better and they want to take these drugs to get better. So I don't know who this Joanna Moncrief is, but she sounds like a crank to me. Um, I'll never regret taking Prozac, whatever scientists are saying now. So here's the reaction by a patient. For 25 years, I've been taking Prozac. Well, it's not evidence, right? Here's obviously a very smart person. She's written a really great article where she goes through some interesting things. You can check it out, but it's not really evidence. So here we go. Here's the article. So what would the evidence be? What would evidence be that this drug actually works? Now, remember, when we look at drug effects or any kind of treatment effect, we have to look at meta-analysis. You can't look at one trial unless that trial just happens to be the golden randomized control trial with massive numbers of people done by an unbiased source. You really want to look over time at a variety of sources. And when you look at multiple trials together, that's called meta-analysis. So systematic review, that's where the researchers take a structured and unbiased attempt to look at all the medical literature, and meta-analysis, looking at them all the studies that are out there together. Here's one that came out in the journal Cognitive Behavioral Therapy. I'm not familiar with this journal, in 2017, so it's old as well. But I couldn't find anything on this question that was more recent for adults. And what they found was that cognitive behavioral therapy and SSRIs are the two first-line treatments for depression. When they combined 13 studies with 4,000 patients, they found moderate improvements in quality of life post-treatment for both cognitive behavioral therapy and SSRIs. This cognitive behavioral therapy was actually better in the long run over a long period of time in the patients who had a bigger effect. Cognitive behavioral therapy is literally awesome, but it also takes time and it's expensive. So it's just frankly not available for a lot of people. It's not something that can be done in a primary care environment. So if these SSRI antidepressants, are Zoloft, Paxil, Prozac, and Effexor, if they're just as good as cognitive behavioral therapy, then that's actually quite a big plus for cognitive behavioral therapy. For the SSRIs, they're going to be the way to go. Antidepressants versus placebo for depression in primary care. Here's another meta-analysis from the Cochrane Review. I find these guys to be or these investigators, pardon me, I'm misgendering someone, I'm sorry, but I find them to be very non-biased, and they're very thorough and have a very high level of biostatistics. Cochrane was looking at studies on antidepressants, and they looked at the two common antidepressants that are used a lot are tricyclic antidepressants and SSRIs. The big to do today is about the SSRIs because of this study saying serotonin is not involved in the cause. But anyway, what they found was that there were 14 studies. They extracted all the data. 1,364 patients, 9 in one group, 919 in the other. And what they found was that basically the SSRIs were effective in treating depression. Does that mean they cause depression? No, no one ever said that, right? What this is saying is that SSRIs are effective in treating depression, not causing depression. So, just annoys me when this media stuff happens and people kind of jump on the bandwagon. Interestingly to me, my thought was, okay, well, if SSRIs are so good at treating depression, and clearly they are, there must be fewer suicides, right? Because we're seeing so many deaths of despair. Not really. When you look at the suicide rate of SSRI on people with SSRIs, it's actually hard to find any evidence that the suicide rate is lower. And there have been some studies that sort of hinted, non-conclusively found that it might be higher. So interesting, although it's effective, these SSRIs are effective in reducing depression, they're actually not super effective in reducing suicide, which is a bummer, because obviously suicide is the worst possible effect of depression, and we would like for it to be relieved. Well, that's all for today. I think this is an example where if I'm on one of these big four SSRIs and I see this flurry, I may think to myself, gosh, I'm not going to take my Zoloft anymore. Huge mistake. That kind of action is not justified by the information available. I think it was really irresponsible, quite frankly, of some of these psychologists to make these statements talking about taking the drugs when they knew darn well that this finding of the etiology of depression was a different issue. So I would encourage you to talk it over with your doctor. That's definitely an opportunity for that. Show your doctor these reports and see what your doctor thinks about it. And call ahead to the office so that your doctor has time to gather their wits and do their research and is ready for you and is ready to respond. But definitely an interesting day. Well, that's all I have for you guys. Thanks for listening. I'll look forward to seeing what tomorrow may bring. Hope you're having a great day, and talk to you soon. For Best Practice and Phoenix Spine and Joint, I'm Dr. Dan Lieberman.